I know that we had a problem with CDiff because I was notified of the number of CDiffs that we did have. So on an annual basis for 2016 we had 7, in 2008 or 17 then we went up to 9. So we were increasing. We also had a penalty through CMS of 1%, which was quite a big hit to the hospital. Our goal was to get down to that standard infection rate, which we are currently at 1.22 in 2017. We wanted to get that down to the 0.7, which is what the goal is to not have a penalty through a CMS. To achieve that goal, we focused more on the number of days that we would go between having a hospital-acquired infection. Our goal was to aim was to get greater than 120 days without a hospital-acquired infection. So to improve our CDiff, we took a proposal for a nurse-driven protocol to Patient Care Review Committee, in which stated that if the patient had 3 loose stools in 24 hours, that the nurse would have the ability to order that test without a physician's order. The reason we wanted that is if the quicker the patient is tested for CDiff and is positive, then we don't get counted against us as hospital acquired. It would be counted as community acquired. We also created an infection alert that is on all their banner bars, and that was a way for the nurses to be able to see if the patient needed to be in isolation alert. We also created a stop sign that was purple, which was specific for CDiff. That would tell the ancillary services that they needed to clean their equipment with bleach. Bleach is the only thing that kills CDiff. We also created a form when a patient was diagnosed with CDiff in the hospital that they could take home to understand how to take care of their environment so their family members wouldn't get CDiff. So in order to ensure that we were documenting accurately the number of patients that had the CDiff in our hospital, the Department of Health and Human Services came in and did an audit to double check all the reported CDiffs to them, and it did appear that we were recording them accurately. All right, so we had an initiative to better educate the community on antibiotic overuse and the side effects. In calendar year 17, we had a total of 9 hospital-acquired infections, and currently for calendar year 2018, we have 2 hospital-acquired infections. In that same time frame in 17, we had a standard infection rate of 1.22, and currently we are at a standard infection rate, or a SIR, of 0.84, and that takes away the penalty for CMS. I would continue to educate the staff and the physicians on the importance of CDiff. And then I would also want to make sure when doing groundings that we are cleaning our rooms with bleach and that they have the correct products available to clean their equipment with bleach. And then continue to educate the public on the importance of antibiotics use and the side effects of CDiff.